Welcome to the weekly Neurology Deep Dive, bringing you the latest in neurology research tailored for busy clinicians.
Always great to be here.
A quick reminder, this is for educational purposes only, not medical advice.
Right, we're giving you the highlights.
So definitely dive into the full paper for the complete picture.
Absolutely.
Today's deep dive takes us into Myasthenia Gravis.
Ah, MG.
Specifically, we're looking at a real-world study
Okay.
comparing two newer treatments
Interesting.
for acetylcholine receptor antibody positive,
You know it as ACR-AB plus AMER?
generalized myasthenia gravis.
That's the ACR-AB plus GMG.
This study, hot off the press in neurology, neuroimmunology, neuroinflammation,
Offers some practical insights you can use right away.
right in your practice.
It really helps to see how those clinical trials translate to what we actually see
Exactly.
day to day with our patients.
Let's break down this study.
Uh-huh.
It's all about Ravulizumab and Efgartigimod
Two fairly new treatments.
for GMG.
That's right.
So walk us through this study design
Sure.
and the patient population.
So the researchers, they did this prospective study, exploratory, at two certified German MG centers of excellence,
Wow. Centers of excellence.
focused on patients new to these drugs.
Treatment naive, right?
Exactly, treatment naive.
Okay.
A total of 62 patients,
Okay.
41 on Ravulizumab
Uh-huh.
and 21 on Efgartigimod.
Interesting. So tell me about the patients.
Okay,
Were they newly diagnosed?
so that's an important point.
Okay.
These weren't your straightforward cases.
Got it.
These patients, median age 64,
Okay.
had MG for a median of 5 years.
Okay.
Most of them were moderate to severe.
In terms of disease, right?
Yes, MGFA 2 to 5.
Yeah.
And here's the thing.
Yeah.
63% were considered treatment refractory,
Treatment refract.
meaning they hadn't responded well to other treatments.
So a tough group to treat.
Very tough group.
Did either of these new drugs help them?
Well, both Ravulizumab and Efgartigimod showed some promise.
Okay.
They both led to improvements in MG-ADL.
NGADL.
That's the score that measures how much the disease impacts daily life.
Okay, so what kind of improvement are we talking about here?
With Ravulizumab,
Uh-huh.
there was a mean decrease of 1.35 points
Okay.
in that MG-ADL score at week 10.
And weeks, okay.
Now, for Efgartigimod,
Mhm.
it was a mean decrease of 1.10 points at week 4,
Okay.
and then further down to 1.65 points by week 8.
So a bit faster acting with Efgartigimod, it seems.
Yeah, seems like it.
Based on those numbers.
Yeah.
Did they look at QMG scores at all?
Yes, they did. Ravulizumab, there was a slight decrease
Okay.
in the QMG score at week 10,
Okay.
but with Efgartigimod,
Yeah.
there was no statistically significant change
Interesting.
at either week 4 or week 8.
So a little discrepancy
Yeah.
between the two scoring systems.
Yeah.
What about, how did they define clinically meaningful improvement?
Good question.
And what were the results?
So they defined clinically meaningful improvement
Okay.
as a decrease of at least 2 points on the MG-ADL,
Okay.
or at least 3 points on the QMG.
Okay.
And based on that definition,
Mm-hmm.
44% of the patients on Ravulizumab
Okay.
showed improvement on the MG-ADL,
Yeah.
compared to 35% for Efgartigimod.
For Efgartigimod.
Okay, on the QMG, it was 29%
29?
for Ravulizumab
Uh,
and 20% for Efgartigimod.
so both treatments had an effect, but it seems like Ravulizumab might be a bit better,
Yeah, based on these numbers anyway.
at least in terms of hitting that threshold
That's right.
of clinically meaningful improvement.
Yeah.
What about minimal manifestation status?
Mm,
You know that MG-ADL score of 2 or less?
yeah,
Did they look at that?
they did. And the results were pretty similar
Okay.
for both drugs.
Okay.
Minimal manifestation status was achieved
Uh-huh.
by 14% of the patients
Okay.
on Ravulizumab
Okay.
and 15% on Efgartigimod.
Interesting. Now, these treatments, they work in completely different ways.
Totally different.
Did the study shed any light?
Well, this is where it gets interesting.
Okay.
You see, Ravulizumab targets complement component C5.
Okay. It blocks it.
Essentially, yeah, blocking part of that immune system attack.
Okay.
And in the study, they saw a significant reduction
Okay.
in the serum levels of those activated components,
Which one?
C5a and SC5b9.
So hitting its target
Right.
and reducing those markers
Exactly.
of immune activity.
Yep.
Now, Efgartigimod,
totally different approach.
Completely different.
Efgartigimod is an FcRn modulator,
Okay.
which means it enhances the degradation of IgG antibodies.
It's like boosting the body's cleanup crew
That's a good way to put it.
for antibodies.
And the study, they found that Efgartigimod,
Yeah.
it significantly reduced
Right.
total serum IgG concentrations
By how much?
by a median of 41%
41%.
at week 8.
Wow.
So both treatments are hitting their targets.
Right.
But here's the big question.
Okay.
Did either one of them actually change how those AChR antibodies function?
Ah, the million-dollar question.
This is where the study throws us a curveball.
A curveball.
Despite targeting different parts of the immune system,
Mm-hmm.
neither Ravulizumab
Okay.
nor Efgartigimod
Okay.
had a major impact on the functional capacity.
Of those AChR antibodies.
That's right.
Now, that is unexpected.
It is.
You reduce the complement attack
Right.
or the overall number of antibodies.
Mhm.
You'd think their ability to cause problems would go down too.
You'd think so.
This is a key finding.
Definitely.
Let's unpack this a bit more.
I'm ready.
After a short break,
Sounds good.
we'll be right back.
Okay. Yeah, it really is counterintuitive.
It is.
And it kind of speaks to how complex MG is. You
Mm.
know, we see these reductions in
Mhm.
complement activity and IgG levels,
Yeah.
but the ability of those AChR antibodies to actually mess things up.
At the neuromuscular junction.
Exactly. That ability seems to stay the same.
Unchanged.
So just kind of dampening the immune response,
Yeah.
it might not be enough.
To fully control the disease.
In some patients, at least.
Right. So for us neurologists, what does all this mean?
That's the key question.
How do we take these findings and actually help our patients?
Well, first of all,
Yeah.
this study really adds to the evidence
Yeah.
that both Ravulizumab and Efgartigimod
Mhm.
can be helpful for AChR-AB plus GMG.
Especially for those who aren't responding to other things.
Exactly, those tough cases.
Which is good news for them.
It is.
But you mentioned a curveball earlier.
Right.
What should we be cautious about with these treatments?
Well, it's really important to manage expectations.
Okay.
The study found that the responses, they were all over the place, heterogeneous.
Meaning?
They didn't work the same for everyone.
Right. So not a cure-all.
Definitely not a one-size-fits-all solution.
So personalized medicine is still really important.
Ab-
Anything else practical we should keep in mind?
Well, the study also highlights the need for continuous treatment
Okay.
to keep the disease under control.
Mm-hmm.
Remember, neither drug really changed
Yeah.
the way those antibodies work.
Right.
So stopping treatment,
Could lead to a relapse.
exactly,
So important for long-term management.
it is.
Any other pearls of wisdom for our listeners?
I think the biggest takeaway is that we need more research.
Always.
We need to figure out
Wait.
what makes some patients respond better to one drug or the other.
Like biomarkers.
Exactly, biomarkers.
That could predict who would benefit most.
That would allow for truly personalized treatment.
Tailoring it to each person's biology.
Precisely.
That would be a game changer.
It would.
Anything else stand out to you from this study?
Well, they didn't report any serious adverse events
With either drug.
with either drug.
So a good safety profile,
Seems to be.
which is reassuring.
Especially for these patients who have already tried so many other things.
Exactly. Effective and safe.
That's what we want.
That's the goal.
It is.
This study gives us some valuable real-world data
It does.
to help us make better treatment decisions.
Absolutely.
Great insights, as always.
My pleasure.
So as we wrap up this deep dive, what's your take-home message for our listeners?
I think it reinforces what we've been talking about.
Yeah.
The need for a personalized approach to MG.
Okay.
These new biologics offer hope.
For those treatment-refractory patients,
Exactly.
but we have to manage expectations,
Yes.
monitor for the long term, and stay up to date
Absolutely.
on the latest research.
To provide the best care.
Well said. Now,
Yeah.
let's go back to that surprising finding.
The one about the ACR antibodies.
Yes, neither drug seemed to affect how they actually work.
Right.
It really makes you wonder,
What else is going on?
exactly, what are we missing
It's a good question.
about this complex disease
It really is. There's clearly more to the story.
than just complement and IgG levels?
Right.
Some researchers are even looking at T cells, another type of immune cell,
Interesting.
thinking they might be involved in driving that autoimmune response.
Fascinating.
Always something new to learn.
Isn't there?
That's what makes neurology so interesting.
It really is. The brain and the immune system, so complex.
And for our listeners out there,
Yeah.
dealing with this complexity every day, it's so important to stay curious,
Yes.
stay informed,
Absolutely.
and always look for new
To
ways.
improve patient care.
Couldn't said it better myself.
Thanks.
So, to sum it all up,
Okay.
for our busy neurologists, this deep dive comparing Ravulizumab and Efgartigimod
Yeah,
has given us some key takeaways.
it has.
Both treatments showed,
Moderate efficacy.
but it varied,
Yeah.
especially in those treatment-refractory patients.
Right.
And importantly,
Yes.
neither one really changed,
How those AChR antibodies function?
which raises questions
It does.
about how we manage this disease
Long term.
long term. A
Definitely.
lot to think about.
A lot to think about.
What are your takeaways from this study? How will you use these findings in your practice?
It's a good question.
We want to hear from you.
Yeah, share your thoughts.
For me, it's a reminder
Of what?
that we need to go beyond just managing symptoms.
Okay.
We need to understand the disease better.
The underlying mechanism.
Exactly. That's where the real breakthroughs will happen.
Absolutely.
We'll put for a deeper dive
Literally.
into this study.
Yeah.
Check out the full paper,
It's in neurology, neuroimmunology, neuroinflammation,
full of details and insights.
to help you stay on top of MG treatment.
And with that,
Yeah.
we wrap up another episode of the Weekly Neurology Deep Dive.
Another great one.
Thanks for being here.
As always, my pleasure.
And to our listeners,
Yeah.
thanks for joining us.
Thanks, everyone.
Until next time, keep those brains engaged
Keep learning.
and those patients thriving.
That's what it's all about.
See you next time. We're definitely seeing some really promising developments in the
Absolutely.
treatment of MG.
Really exciting times.
But like we've been talking about,
Yeah.
there's still a lot to learn.
There is so much we don't know yet.
And that's what keeps it interesting, right?
That's what keeps me coming back for more.
So for our listeners who are using this knowledge every day with their patients,
Right.
what's your advice
Mm.
on how to approach these new treatments?
Well, I think it's important to remember that every patient is different.
Of course.
There's no one-size-fits-all answer.
Right.
You have to really consider each person's individual situation.
Their medical history, their disease severity.
Exactly. And their goals for treatment.
So when you have a patient with treatment-refractory MG
Mm-hmm.
sitting in front of you,
Yeah.
what are you thinking about?
Well, first and foremost, I'm thinking, are they a good candidate for these treatments?
So careful patient selection.
No, absolutely. These biologics are powerful,
Powerful tools.
but they're not magic bullets.
not a cure-all.
Right. They don't work for everyone.
So it's really about finding the right treatment
For the right patient.
at the right time,
Exactly.
which is why research is so important.
It is. We need more studies like this one.
Real-world studies.
To help us understand
How these treatments actually work.
in everyday practice.
And speaking of research,
Mm-hmm.
this study raised some interesting questions
It did.
about how MG works.
Wow.
You know, the fact that neither drug really changed.
Right.
How those AChR antibodies function.
That was a surprise.
It really does suggest
But there's more to the story.
than we initially thought.
There's always more to learn.
It makes you wonder what other factors might be involved
It does.
in the development of MG.
Right. Right.
What are you most excited about in terms of research?
Well, there's a lot of interesting work being done
Okay.
on T cells.
You know, those immune cells.
Right. And some researchers think
What do they think
that they might be driving the autoimmune attack.
in MG?
It's a fascinating area of research.
It is always something new to explore.
Always.
That's what makes neuroimmunology so compelling.
Absolutely. The brain and the immune system.
So complex.
So interconnected.
Well, for those who want to delve deeper,
Into the study itself.
yes, be sure to check out the full paper.
It's in neurology, neuroimmunology, neuroinflammation.
And with that,
Yeah.
we wrap up another episode
Another great discussion.
of the Weekly Neurology Deep Dive.
Always a pleasure to be here.
Thank you for joining us.
Thank you.
And to our listeners,
Yes.
thank you for tuning in.
Until next time,
Keep those brains engaged
keep learning.
and those patients thriving.
That's what matters most.